only really the heart rate, which I'll talk about in a minute. But one of the things I think about being in a clinical trial, and they're very upfront and honest with you, and I knew this coming in, you get no control over the dosing. So when I had my first box of Retta, so that was 4 weeks, I went into the clinic and I had lost 6% of my body weight in 4 weeks.
Whoa.
Now, if that was the real world, I would have gone, this is working great for me. Please keep me on this dose. But of course, you don't get that choice in the clinical trial. And they go, yeah, that's great. Look, 6% of your body weight. Fantastic. We're now doubling your dose.
Yeah.
Yeah. So the grading
Hang
up
on,
period.
here we go.
Yeah. The grading up period was extremely hard because I would get side effects at the beginning of the month. The side effects would slowly start to taper off and become manageable at the end of the month. And then I'd have another dose escalation. And so I had to go through that cycle 5 times. And that's kind of how I worked out that I think I'm on the maximum dose, because they said you'd either go on a 4-dose schedule or a 5-dose schedule. And I had to go through that grading, going through the side effects. It was really, I won't lie, it was really, really difficult having to grade up that fast. And the thing that honestly kept me going was there are Reddit forums and Facebook groups for people who are in the trial. And, like at one stage, I couldn't get any solid food down at all. I was just entirely living on liquids. It was really, really bad. And I had terrible skin sensitivity. And I remember going into those forums and talking about my side effects, and other people who were further ahead in the trial saying to me, just stick it out if you can, because once you finish that final box, that 5th box, it will all settle down. So I just, did what I had to do. I took Zofran, I took Imodium, I took antihistamines for my skin sensitivity. I just took whatever I had to take to keep getting through. And then they were right. At the end of the 5th box, once I stopped grading up, all of the side effects went away. And I don't get any side effects at all anymore.
So crazy.
Yeah. But
it's the
those
same
5
ones
months
that
were
we
so
get,
hard.
right? Like GI.
Yeah, exactly. Skin sensitivity, nausea, vomiting, diarrhea, constipation. The only thing I did get fatigue the first month, but I think that might be due to the reduced food intake, because after that, it actually feels like it revs me up. Like I really feel this has got a very big fat burning metabolism rev up component to it, because when I was particularly when I was doing the grading up, I would notice like the night after my injection, I would just not be able to go to sleep at all. I was so wired, and I don't actually have any fatigue at all on this medication. No fatigue whatsoever.
Wow.
Which I had fatigue on Saxenda, I had fatigue on Ozempic. So I think that's been a really big difference. And sorry, I forgot to talk about the heart rate. So my heart rate is 10 beats per minute higher than it was previously. But it makes no difference to my day. I'm not short of breath. I'm not dizzy. I don't feel like I'm having palpitations. The only reason I notice it is that they do get me to check my blood pressure regularly, because I was previously on blood pressure medications, and I've been off them for a while. So, and when you do your home electronic blood pressure reading, it gives you your pulse rate as well. That's the only reason I know. Honestly, if I hadn't been measured, I would have no idea that my resting pulse rate is higher than it used to be.
Yeah.
And was the study like, is it just for weight loss, or is it like maybe are they studying it also for stroke and heart attack prevention or recovery? Or
so the Retatrutide trials are called the Triumph trials, and there's currently seven Triumph trials in total, and they're all looking at something different. So I'm in Triumph 3, which is obesity and cardiovascular. There was some of the earlier ones, I think, looked at knee osteoarthritis, kidney disease, rheumatoid arthritis, or some sort of arthritis, might not be rheumatoid. But what's interesting is Triumph 1 to 4 are placebo-controlled trials. So some people get placebo, some people get drug. The ongoing trials, they're actually using old GLPs as the placebo, which I think is really great, because my trial's 2 years. So 2 years to sit on a placebo and be denied of treatment is a really long time.
Yeah, for
and
sure.
so, of course, you're going to get a really big dropout rate as well. So I think that's really, really sensible that they've done that now. And so the 5, 6, and 7 onwards have got an older GLP as the placebo, and then the Retta as the active ingredient.
Wow. I guess they're probably using Trulicity, or maybe it could be using tirzepatide. I was just
I
thinking older wise, like it would be a weekly one.
Well, do you know Jackson on TikTok?
Oh,
Yes.
Yeah, because I was talking to him about it because his dad has just gone on one of the later
Oh, really?
Triumph trials, and he's either getting TERS or Reta.
oh wow.
Okay.
Yeah, yeah,
Wow.
which is great.
Oh,
Yeah,
that's good.
it is nice, isn't it? Yeah,
Yeah,
yeah.
that's great. Wow. Man, that's a story. So I'm curious, like, are they guiding you through when you have side effects and like telling you ways to manage it?
They record the excuse me, they do record them, so we have to report on that kind of stuff every visit.
Okay.
And yeah, and they tell you things that you can try and things that you can do. But essentially it's very difficult to deviate from the protocol. So some people in the earlier trials, from what I've learnt in our Reddit and Facebook groups, just found the maximum dose too much and did request to drop back a dose, which they were allowed to do. But then what they then found out later on down the track was some of their trials got extended, and so they're wanting to look at a maintenance type program. And they were then deemed ineligible to go onto that program because they dropped down a dose. So essentially, to be eligible, you had to have followed the protocol to the letter the whole way through the trial.
Wow.
Mm.
Do they guide you on exercise or anything with like muscle?
They kind of do, but it's very generic type information. So we do get given a set of resistance bands when we, sign up. And so they encourage us to do regular physical activity and to do some type of resistance training. Same with the dietary advice. It's very, sort of generic. Watch your fluids, keep your protein up, try not to eat too many fatty foods, but there's nothing really prescriptive. We do have to monitor our intake and exercise, but only for 3 days a month. And we can pick which 3 days they are. So they can be 3 days in a row, they can be 3 work days, they can be 3 weekend days, it doesn't matter. And so we just record for that day, what we've eaten that day, what exercise we've done, how much water we've drunk. And then, they look at that each time when we go in for a visit and just go, oh, yeah, well, that looks good, you're tracking well, or, oh, no, you could do a bit more protein or a bit more fiber or whatever.
Yeah. At the end of the trial, do they let you stay on your medicine or do you have to go through the whole approval process and stuff? Or is it just over?
Cold turkey.
Oh my goodness.
Yep. So I've got 4.5 months to go, and then they will cut me off cold turkey. I'm then on a ban for a month from taking any other type of GLP. I have to come back in after the month, and they will do all their blood tests and things because they regularly, one of the things that they regularly do is they check the level of the drug in our bloodstream to make sure that we're not skipping doses or giving the dose to the neighbor or
selling the drugs on the TikTok.
yeah, that's right. They will know if we go in for that last visit and we've taken another GLP, they will know.
Wow.
So then I have to wait a month, and then I am allowed to start on another GLP if I want. I've already talked to the trial staff about it, and the endocrinologist said, yeah, look, I think you're going to need to go on something low dose for maintenance. Really, and I realistically think that as well because it's I just think my previous experience shows that I'm going to need to do that. And the people who've stopped the trial, they've all gained weight in that month. They've all said their inflammation's come back.
Oh.
Yeah. But, look, honestly, they said all this up front. We all signed up for this. We all knew what we were signing up for. And that's what you do when you go in a clinical trial. It's a risk benefit thing, So if I think, but for benefit wise, I mean, if I think about it, so in Australia, Ozempic, depending on the dose, ranges between $200 and $400 a month because we have tiered pricing. And tirzepatide ranges between $500 and $700 a month, depending on the dose you're on. So let's say Reta was $1,000 a month on the maximum dose. I've just got $24,000 worth of free drug for 2 years. Like that's a pretty good trade-off.
Yeah. Plus you feel good too, right? Like I think, there's that, right? Like I think, it's, if we're always thinking about like I think we think about like the regain, right? Because and I remember when this all started happening, when people would lose access in the beginning, like a few years ago. So when people were losing access to the Manjaro coupon and they weren't going to have any more, everybody was freaking out. And like people were saying like, oh my God, I already gained my weight. But then other people were like, no, I can't go back. I can't go back. And what they were talking about was the food noise. It's not necessarily the weight. and what the weight feels like on our body and how much that hurts. It's more of just like the sort of mental torture that we all went through. And now we know what it's like to not have that. And then they're going to put us back, right? It's cruel, you know? And I think like, I know no one's trying to be cruel. Like, I'm just saying that, but ultimately it still is. Like, it's hard to give somebody like life-saving, life-changing medication and then just go, oh, now it's $1,000, you know? I'm like, so I think that like the regain and the inflammation and stuff, like that's just part of the disease, and it would be there whether we had it or not. I do think like, and I wonder if you feel about this, like if I ever had to go on one of the other ones again, like if I went back on Ozempic, I would be okay with that. Like if you know,
absolutely.
like, I mean, I think any of them are a blessing, you know?